When it comes to elderly care, the concepts firstly spring to our mind were poor, diseases, and disability. Mostly, the oldest old population living alone, disability, and dementia were taken to be priority aspects for improving quality of elderly care. However, does that mean the excluded others need no care? To understand what is actually going on, we find some data standing out the ignored parts.
Take an example. As normally ignored, young elderly aged 60 to 69 account for 56.1% of the elderly population in China, according to the investigation conducted by government. Obviously, compared with the oldest old, these young elderly might suffer more from psychological stress rather than physical diseases. That is, the demands of psychological care go beyond that of physical supports.
Another case is those the physical health care of the elderly raises great concern, mostly only focused on inpatients. Actually, the elderly need to know what is happening with the aging body and what exposures they are going through, which may bring adverse health effects. The personal systematic health condition assessment, along with medical consulting, would be the feasible solution to this. Individual-specific elderly care means a lot.
We will not be an old in the blink of an eye. The old is a long time period in our entire life which was personal featured and with significant changes both physically and psychologically. When you are get old and gray, what kind of life would you like to lead? What kind of care would you like to seek? With this question, our team initiated a project named Silverlink.
The Silverlink project, shorted as SLP, is an internet-based psychological care intervention project, which mainly provides psychological care services, both online and offline. To optimize the effect of elderly care, SLP is designed to integrate multi-resources from society via website and social media application WeChat. Based on the China Statistical Yearbook from 2009 to 2018, we calculated the rank of elderly care burden in different regions. Subsequently, a pilot project of SLP will be launched in Shanghai, Chongqing, and the provincial capital of Jiangsu, Anhui, Hubei, and Sichuan. Supporting the policy adopted by government, we will cooperate with universities and non-profit organizations in order to integrate medical and non-medical elderly care resources. Our team is composed of psychological care professionals, medical nursing assistants, system maintenance staff, publicists, volunteers, and etc. In each pilot region, 2 elderly care institutions will be selected as our collaborators and promoters. Selection criterion for institution includes appropriate qualification, business conditions, and cooperation intentions. The target population of SLP covers the elderly aged 60 and more, given the individual and urgent need of relevant psychological or comprehensive care services, according to the reference. Moreover, plentiful services are also available to their family members and other general population.
In addition to professional services such as psychological tests, counseling, and supports provided by professionals, both trained medical nursing assistants and volunteers will submit appointments for various activities and activity spaces for the elderly and review participants' application. For example, during the roundtable sharing, it's encouraged for the elderly to share their experience, mood, and life story to the young freely by interactive communication to peers. These activities are regarded benefit for their mental health. For demands from their family members, our platform provides several health services both online and offline. We also use the new technologies like AI and 5G communication in enhancing the precision of needs. SLP is designed to provide every single of various choices of suitable services for advanced care plan decision and unnecessary cost reduction. Let me show the registration of our online services. After registration on WeChat or website platform of SLP and the user-informed consent confirmation, you can access health resources, related institutions, and service information, as well as reserving other services provided. If they have further feedback, they can inform us by click Contact Us to get prompt reply. Although SLP is designed commercially, it do have aspects of public welfare and social attributes, and we are contributing in enhancing comprehensive effects of elderly care in regions and provide experience for policy adjustment.
Most important challenge is specialization. Our projector requires certificated psychological care professions, senior nursing, and health education personnel. As for medical nursing assistants and volunteers, we should formulate appropriate admittance criteria and provide systematic training for them. Recognize the ability to ensure certain time and high quality of service is required in return. Participation and acceptance are uncertain. Although our projector was designed from the actual psychological demand of the elderly and have confidence about our project, we still cannot predict the actual popularity.
Psychological intervention is both an economic and effective method in care. The elder who receive this intervention have statistical significance compared with the original care, lower disease risk, and improve prognosis. Recently, a model published online showed a measure to evaluate psychological intervention effect from 3 scales, including Attitudes of Aging Questionnaire from WHO, UCLA Loneliness Scale, and Geriatric Depression Scale short form. They rank the score and weights to each scale, calculating the total level of effect to evaluate the psychological condition of subject. Furthermore, we want to introduce the blockchain technology to ensure the data safety. The blockchain technology supported by our government makes data unique, secure, and trackable, supporting the efficient and effective continuity of care by offering track and share individual entire health information to related medical staff.
We will conduct a short-term plan, including platform construction, institutional cooperation seeking, staff recruiting, trial operation, daily care service, user management followed by regular adjustment, and so on. The long-term work is planned for a recent 5 years period. Besides some constant short-term work, our team will be regularly assessed and managed. Staff training and service projects will be optimized, and the impact assessment will be carried out in cooperation with universities and scientific research institutions to win more government support, cross-institutional cooperation, and foundation support chances.
For budget, we must purchase a lot of necessities at the beginning of the project. Direct cost, including official equipment, network and website establishment, communication cost with various departments, expert consult cost, advertisement serving cost, staff training cost. In addition, we managed to employ 15 full-time staff, 15 part-time staff, and 13 long-term volunteers to run and maintain our project. The total cost is $92,000 annually. In further 4 years, we decided to cost $2 million annually as regular maintenance and advertisement import cost, and a total $3.7 million as salary and bonus to our staff. Moreover, we devoted to enlarging the source of income to make our project sustainable and profitable. As our project design is tightly integrated with the government's guideline, we can take the subsidy support annually. Next, advertising effect, which will induce more clients to purchase our service. Finally, we have cooperation with university and non-government organizations or foundations. They can provide us funds for further analysis.
We will evaluate the impacts of the program from following 4 aspects. Health-related quality of life will be used to assess the elderly's health status at 3 months, 6 months, and a 1-year time point from registration. With the assistance of EQ5D or SF36 instrument to measure health-related quality of life, direct effects of our program will be demonstrated according to the comprehensive and precise measurement results. Family members of our clients will also learn a lot from our online courses, change their attitudes towards elderly care and getting old. We plan to conduct a satisfaction survey on relative skills and knowledge of elderly care. Additionally, suggestions from the angle of the requirement are also important. Actual funding and sponsor willingness of the government is no doubt a vital recognition and appreciation for our project. It's time for feedback about the design and scale, quantity and quality of our project, and the promotion of the whole pension industry from cooperators. In long-term plans, we can also provide evidence and information of psychological well-being of the elderly for academics and scientific institutions.